we also know that the neglected tropical diseases program of the Ghana Health Service is going to undertake massive immunization or vaccination program. And we have Bright Alomatu, who is with the program, with the Ghana Health Service, and he's here in the studio. Good morning to you.
Good morning.
And Max, we're also asking some critical questions,
yes,
especially knowing that it concerns elephantiasis.
Yes. All right, so let's discuss the current situation in Ghana.
Yeah, so for the two diseases that we are coming to do the mass distribution or the mass drug administration against, they are elephantiasis and then onchocerciasis.
Yeah.
For onchocerciasis, we've been working since 1974. The disease is caused by a kind of worm that lives in the body, and it is transmitted by the black fly. Normally, they breed in fast-flowing rivers. So those areas that we have those fast-flowing rivers, we have a lot of the black flies, and they pick the infection from somebody that is infected, and then when they come to bite you later on, they give you the infection. And the eventual effect of the infection is blindness, and that is why we call it river blindness, because it's found where we have those
But
rivers.
the scientific name is onchocerciasis.
Onchocerciasis,
yeah. Okay.
yes. Yeah. And we had been treating 85 districts. Now we have added 34 to those districts that this particular round we are going to give the medicines in. So they are found, these districts are found in 9 regions. It's only Greater Accra that we don't have onco as a problem. And for lymphatic filariasis or the elephantiasis, it's also a kind of worm that lives in the blood. They are very tiny worms. They are not those in the intestines that we know, but these kind of worms live in the blood. They are also spread by the mosquito. It's a very anopheles that transmits malaria that also transmits this one. And the disease affects the legs. The legs become so big and it looks like that of the elephant, and that is how come they call it elephantiasis. But it doesn't affect only the legs. It can affect the hand, it can affect the breasts of some women, it can affect the penis of men, it can affect the scrotum. And we also have hydrosol, the very big one. That one is accumulation of fluid in the scrotum. And the one scientists call echo and others we call evo. So these are some of the effects of these diseases. Largely, they don't kill, but they can cause so much deformity. They come with so much stigmatization, social rejection, and they perpetuate the cycle of poverty, because they are largely found in rural areas and urban slums, and people that live in these areas don't have the political voice. They are not seen, they don't have that visibility, and therefore their issues are not seen by others. And if these people are the poor and they suffer this and cannot produce anymore to take care of their families, and they themselves becoming burden upon the other members of the family, then you can see that the cycle of poverty gets perpetuated by the affliction of these diseases. So this is what we are dealing with.
Now, prevention being better than cure, how can this disease be prevented?
Yes, so because the parasites live in the human being and they are transmitted by these other flies, what we do is that we give medicines to the people that live in the areas that we have the infections. And then when they take the medicines, they kill the parasites, and when the fly comes to bite, they will not get the parasite to pick and then spread to other people. So that is the strategy. The other strategy is attacking the flies, but that has been very daunting. And it's much easier seeing the human beings and then giving them the medicines. And if we clear the disease from us, the flies will be there anyway. They will bite, but will not get the infection to pick and then spread. You go to Europe and other places, we still have the black flies in many other areas, but they don't have the infections in the humans for the flies to pick and spread. So that is the strategy that we are using. And what we do is that every year we organize national level training where we invite people from the regional levels. And after the regional training, they also do, after the national training of trainers, they also do regional level trainings, and then they do district level trainings. And then at the district level, they train volunteers that live in the communities with the people. And then these volunteers are given the medicines and other supplies to go around with. They move from house to house, register the people. We have certain registers that we have given to them, and they register people and then administer the medicines. And there are two main medicines that we are giving out. We have the one in the small bottle, we call it ivermectin or mectizan. The tablets are small like this. The mectizan is taken according to height. So somebody will take a tablet, someone will take 2, someone will take 3, and one will take 4. 4 is the maximum height.
Okay.
So the volunteers are given poles that have the marks on them. And where we have only onco or river blindness, we give only the ivermectin. But where we have the lymphatic filariasis or elephantiasis, we add the albendazole to whichever quantity of ivermectin you are taking. So everybody takes a tablet of the albendazole and then add the ivermectin to it. So it's the combination that we use for lymphatic filariasis or elephantiasis, and then we give only the ivermectin to those that we are treating against onchocerciasis.
Now, how effective has this strategy been?
Yeah, it's been very effective. As we started with the lymphatic filariasis, or let me say elephantiasis, the districts were 98 in 8 regions. It's only Ashanti and Volta regions that don't have the infections to levels that warrant public health intervention.
And that's because?
Yes, before we start the interventions, we go around, test people, so we know the levels wherever. And there are guidelines, the WHO guidelines that we follow. Prevalence should be at a certain level to warrant this mass treatment that we undertake.
So why do we have those low prevalence rates in Ashanti and Volta region? That's the question.
Well, so what it means is that we don't have people that have the infections in them that the flies are carrying. And again, what happens also is that when you get the infection, you don't start developing the signs of the disease immediately. The parasites hide in you, multiply over years, and they damage the lymphatic vessels over time. So you get to a point where the vessels are unable to do their work. Their work is to carry the fluid from various parts of the body to the heart to be pumped.
So why do we have the low levels of prevalence rates in the Volta and Ashanti regions?
Yes, so the why, I can't say exactly, but
because
what happens?
We have no black flies, or
what are they doing right?
For onco, we have it in Volta region, but it's the elephantiasis that we don't have it to the levels that we expect. So when we did the survey, the levels that we found did not warrant a public health intervention. But it doesn't mean that there's nobody living there with the condition. But what we have also seen is that many of those that have the infection, sometimes you check them, they have the infection in the blood, but they don't have the swollen limbs, because the parasite hides in you for many years. They cause the damage over the years before you start seeing signs of the disease. And there are people that can live their whole lives with the infection but will not develop the condition. So largely those that have the swollen limbs and all, you test them, most of them, you don't even see the parasites in them. They have come to cause the damage and are dead and gone. So unfortunately, they are those that people fear. They think that they will give them the disease, but actually most of them don't even have the parasites anymore. It's those of us that are walking around nicely dressed and all that don't think that we can get them. We are those that rather have them. And again, one biggest problem with these conditions is that risk perception is very low, because people, when you talk about elephantiasis, nobody thinks I can get it. We think that probably that person is far off. And therefore, when we are doing things about them, people don't get involved. Even when we are giving the medicines, people think, oh, this one, you take it somewhere, I can't get it. But we are all at risk once you live in an endemic area. Yeah, so I was saying that for elephantiasis, we had 98 districts. So we started doing the mass treatments from 2001. And as at last year, 83 of the 98 districts had brought prevalence to such low levels that we no longer do treatments there. So we have only 15 that are treating for elephantiasis now, and it is very serious. It's very disfiguring. You can imagine somebody living.
What you have there is
elephantiasis. It can affect. You can even have one person that has that of the legs, that of the hand. I think some few years ago there was a gentleman.
Multiple deformities.
Yes, there was a gentleman who had it in 3 parts. He had the leg, the hand, and then he had the hydrocele. So
the hydrocele is the scrotal.
Yes, the scrotal swelling. It can be so huge. Yeah,
what
so
is inside there?
It's fluid that should circulate, but because the vessels are not working well, it collects at one point. Yeah.
So when it's in this state, is it curable?
It doesn't have a cure, but we can manage. It has treatment. So what we do is that
the picture we are seeing there is management.
Yes, we take them through. Yes, we take them through certain management protocols. We teach them what to do.
So this is management.
Yes, they can only manage. Yes, so it's not easy. So they are unfortunate. They couldn't prevent in that state. But what I can say now is that now there is that opportunity for people to prevent this from happening to them, and that is why we are doing this.
When are you starting?
Yes, the process has already started.
Okay.
It started from Monday in all the districts. So as I speak, treatment has started, and it will be on until the 5th of June. Yes, so I will ask everybody to take advantage of this. Wherever you are in the districts, they make announcements. We are doing these treatments in 125 districts in all.
Are you doing some in Tema?
Not in Tema. Greater Accra this time, all the districts are out. We finished in 2014 when we checked the districts in Greater Accra and realized that the infection levels.
I'm wondering why.
Yes, it's sampled, so you might not be sampled, but the work is done.
So it's possible
and
you
the
may
levels
miss some infected people.
It's possible, but as you sample, there are certain parameters that we look at, and there are certain things that come to play. Yes, so as at this point, as we don't do the treatment here anymore, those that have the conditions, we have ways of helping them, and it's a process that is ongoing, and we are collating the numbers who have them, and then we will have a system of training for the health workers in the region so that they can also help the patients that have this.
Okay. So any side reactions and to the medicine?
Yes, every medicine has a possible adverse event. Yeah, and these ones also do have, but largely they are most often due to people that are taking it for the first or second time that have a lot of infections in them, and when the parasites are killed, the body responds in various ways. But some of the effects that we have seen people have is headache. Some feel weak. We have nausea. We have vomiting. We have diarrhea. We have bodily pains, and some even have some parts of the body getting swollen. But most of them are self-limiting. They go away in no time without even treatment.
What is no time?
Oh, within a few hours, they go away.
Swelling will go a few hours?
I said some of them. Yeah, even the swelling, maybe a day or two, it goes away. But if it is moderate, we have mild, moderate, and then severe events. So the moderate ones, we have these arrangements with the various health facilities that attend to these cases without getting them to pay for it. So for the moderate and then the severe cases, the volunteers report to the nearest health facility, and then the people are seen free of charge, and they wouldn't have to pay for anything. So it is largely very safe. It's just a few people that have some of these reactions. But because the thing is happening on mass basis, if something happens to one person, it gets so much, it gets out there so much. Yeah. So this is what happens, but there is a system in place to help those that have any adverse event.
Okay. Before you go, any last message you'd like to share?
Yeah, so I would say that these diseases, a lot of them, let me say for elephantiasis, it doesn't have a cure. Onchocerciasis, you get blind by onco, it doesn't have a cure. But we have an opportunity to prevent these diseases. So I'll ask that wherever you are, if you hear of the treatment, try and take advantage of it to protect yourself against these dreadful diseases.
All right. Thank you. That's Bright Alomatu, with the Neglected Tropical Disease Program of the Ghana Health Service.